Hey guys, what's up? Today's podcast is brought to you by Audible. Get a free audiobook download and 30-day free trial at audibletrial.com/eggshow. That's EGGSSHOW. Audible has more than 180,000 titles to choose from for your iPhone, Android, Kindle, or just about any device you can imagine. As Eggs listeners, you can download a free audiobook today by visiting audibletrial.com/eggsshow.
Bang ding ding, trademark. He come out 6'7" tall. Bang ding ding, one is star. Bang dong ding dong ding dong ding dong ding dong ding dong ding. This is a perfect day.
Woke up to the sound of the garbage truck again. Upstairs neighbor's toilet's leaking on my head. And cars broke down, I missed the bus, there runs a 10. I had a feeling this was a day to stay in bed. I finally left my pad right under Jumbo's cloud roof. A police officer pulled out his gun and said, I said, sir, you got the wrong guy. I guess it's just a perfect day. It's just a perfect day. Na, 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 na,
Hey everybody, welcome to Eggs. This week we have Jennifer Weiss. She is an orthopedic surgeon specializing in pediatrics and sports. She also, as you may have gathered by Jennifer, is also a woman, although in today's society you got to be careful. So this makes her part of only 6% of female orthopedic surgeons in the U.S. Her goal is to help aspiring female surgeons find their way in medicine and become successful and encourage more people to take up the field of orthopedics. She's a mother of 3 and has a million little pearls, tips, and tricks to integrate family, work, self-care, and all that good stuff, balancing all those along with relationships, patients, friends, and colleagues, etc. So without any further ado, allow me to introduce Jennifer Weiss.
Oh, what a kind introduction. I want to meet that person that can teach me all that stuff. That sounds
Right?
Well, I guess we're making some generalizations, right? Because, so, first of all, orthopedic surgeon. Second of all,
Yeah.
mother. And I happen to work with live with a wife who is she's, a school teacher and has kids at home. And I know how tough life is for her. I can't imagine with the hours of a surgeon and everything else. So we may be making some assumptions that you have lots of information about that stuff, but I think it's probably pretty right on.
No, I actually think I do. I don't want to be overly humble and make people think that I don't have something to say. I do, but it is, I think every day a lot of women in my field say this, there's this imposter syndrome thing that I'm like, wait, how am I making it all happen? How are my 3 children alive and thriving and my patients seem happy and I think I'm a good surgeon. I know I'm a good surgeon. Like, how am I doing it all? Sometimes I have to stop and kind of blink and remember that I am.
Yeah, well, and I think, it's especially important. I don't know if you get a lot of this out in California because folks tend to be a little more progressive than they are out here in Utah. But for us, like I like my wife, for example, is constantly getting pressure from sort of the stay-at-home mom class who, sort of give her grief for being a working mother as if she couldn't be doing enough for her kids or doing enough to manage the house. And so your story, I think, is really interesting to me, because, while my wife's schedule is very difficult, it's pretty routine schedule versus that of a surgeon. And so I'm very interested to hear, how you kind of balance everything.
Yeah. So before we get down that route, though, let's do just kind of a brief overview of where you went to school, how you got into orthopedics, why you chose that, and maybe even just a overview of what orthopedics entails for us laymen here. I had to Google it.
Yeah. No, fair enough. I was waiting for that question to lead off. So I'll start off by saying that an orthopedic surgeon, we are surgeons that take care of musculoskeletal problems. So broken bones, torn ligaments, sports injuries. The most common surgery I do, for instance, is an ACL reconstruction on kids, meaning when kids tear their knee up playing sports, I'm the one who goes and does a surgery for them.
That was actually my next question. What's the most common?
Yeah. So that's what I do. Going way back when I was in kindergarten, I will tell you that my answer when you used to go around the circle and say, what are you going to do when you grow up? My dad was an orthopedist. So I would say I'm going to be, number one, a ballerina, of course.
Of course.
And number two, an orthopedic surgeon. And they were both going to happen in my mind. And I do know actually a couple of women who are or were ballerinas and then orthopedic surgeons. And so they're definitely
I was going to say, it's not too late.
Correct. I could also be a ballerina at the age of 47. That would be amazing. But what happened was, as I grew older and saner, I said, heck no, I'm not going to be a doctor. My father is way busier with work than I ever want to be. And then I said, well, maybe I'll be a doctor, but I'm certainly not going to be a surgeon. And then as I went through medical school, what happens in medical school is the first 2 years you're in the classroom. And then, at least this is sort of historically, things are changing a bit. And then when I was in medical school, the last 2 years were clinical, meaning you got to go out on the floor and learn from actual doctors and see patients and stuff. So as I went through my rotations, I recognized that I really liked surgery. So I said, okay, great, I'm going to be a surgeon, but I'm not going to be an orthopedist because I don't want to be around men all the time in that crazy sort of all-male club. And then I did my orthopedic rotation because I had to. It was mandatory in the rotations that I had chosen, and I fell in love with it. And my father was just gloating, just incredibly during that time of my life. But I was definitely not I wasn't the sort of person that wanted a life to be encircled by all men. And so what's interesting is within orthopedic surgery, the field within orthopedic surgery that has more men, and we're up to almost 20%. So we think it's really good in pediatric orthopedics and in kids orthopedics. So when I chose to be a pediatric orthopedist, which happened after doing 5 years of orthopedic residency, I chose it, I thought, for a number of reasons. But when I go back now with my brain, I think, you know what, I think I wanted to have a couple women around me at least. So that's kind of the orthopedic bent. You asked me about school. I grew up in New Jersey, and I went to a beloved school from K through 12 called the Pingree School. I loved it. And then I went to Williams College, which is a liberal arts school in Massachusetts. I went to medical school at Mount Sinai in New York City, and then I did my residency in Texas and Houston.
Hey, my brother-in-law is there right now. He's going through residency.
No,
he's a hematologist. Works with blood disorders.
Is he at Baylor?
I honestly don't know, but he's in residency in Houston right now. So, and my sister has 3 kids and trying to juggle that while he's doing that. So I can relate with your story.
Wow, that's so cool. Yeah, that's a very cool field. And Houston's a very cool place. The medical center is amazing. So then I came out to Los Angeles.
Well, I don't blame you for that. You got, coastal climate out there. Hey, so talk to us a little bit about, and you kind of alluded to it in your conversation. I mean, obviously, I think it's pretty well known that, the medical field in general is sort of male dominated. Can you talk a little bit about, so you did decide to kind of push through that wall. You did decide to kind of, navigate those seas of testosterone, I guess. But how did you, I guess, kind of know to do that? Or how did you feel okay to do that? Because I think that, and maybe I'm wrong. I mean, obviously I can't really speak for the women out there, but I sort of feel like that might become, or sort of look like a wall too big to overcome, or something that's not worth fighting. And maybe they don't feel like they can get into the medical field, or maybe, pursue another path for fear of getting involved with that sort of scene. Can you talk about, I guess, what it took inside you to find your way through and sort of contribute to the female population in medicine?
Absolutely. I think at the beginning of all of this, there were definitely a few years of ignorance is bliss. So, now a little more than 50% of graduating medical students in the U.S. are women. At the time that I was in medical school, we were still the minority, but my medical school classroom was filled with strong women. And so I did not feel like the unicorn that I was going to become at that time whatsoever. And I also, I mentioned my father. My father was a physical giant. He was 6'6". He was a well-known orthopedic surgeon throughout the New York, New Jersey area. And he was well ahead of his time, a supporter of the he for she. And he trained a couple of women residents. He was the chair of the department in New Jersey. And he would bring, when he had a woman in his program, he would just bring her around. And I didn't recognize at the time how sort of manipulative that was for me. But I saw whatever women were in orthopedics in this country, as well as underrepresented minorities, my father would seek out. My dad was a big white guy. So he would seek out people of color and bring them to dinner. And he really just wanted us and the kids in our family to see that it wasn't such a sort of white male-dominated society in medicine, even though it was at that time, and still is.
Yeah, I mean, that's really interesting, just given how progressive that is. I mean, now, sort of in modern times, this is becoming a much more popular idea, and people seem to be making efforts to try and solve some of the problems of the past. But to have been doing that in his practice early on is really like visionary.
Yeah, and if he were alive, he would be just gloating right now, because we did not we didn't appreciate that when we were growing up. We were just like, oh yeah, Dad's bringing someone else to dinner, and he was kind of goofy, even though he was brilliant, and we didn't recognize that was visionary. Now I do.
Yeah, he would have a lot of "I told you so" moments right now.
Exactly. Yeah, so there was that. I am, you can't see me on the phone, but I'm myself almost 6 feet tall. So I'm not a shrinking flower in terms of being petite. Now, there are lots of petite women going into orthopedics today. There should be, there can be, there will be more. But at the time that I did it, there was a little bit of, oh, Jen's applying to be an orthopedic surgeon, but she doesn't really count as a girl because she's big. And the other woman that I was friends with in my class at Mount Sinai who went into orthopedics, who was phenomenal. Her name is Suzanne Miller, and she's in Boston. And she was also a very strong, she had been a bodybuilder actually before medical school. So there was this like, well, if you're going to be a woman, at least you have to have a lot of muscles. And there was, and why and how did I take that leap? At the time, I have to credit my dad. And then I think what happened for me is I started to be supported by a lot of men around me. I didn't focus too much on being a woman at first. But let me tell you, in Houston, in the mid to late 90s, there were some moments that were, I don't know how I got through them. And unfortunately, as kind of in the Me Too era, I'm hearing some of these moments from younger women that are in orthopedics. And all that I know and all that I can do is to say, I'm here, I'm an ear, let's work together to change this. It was a definite ignorance is bliss at the beginning.
Well, have you found or have you observed, I guess, you're saying especially now that, it's about half and half men to women coming out of medical school. Is there some, I guess, attrition or something that comes along? Because if you're one of only 6%, clearly not every woman who graduates is becoming a surgeon. Is there, how come or why are people sloughing off along the way?
Right. So that's so interesting. So I've been doing a bunch of work looking at the percentages of women in a bunch of different fields. So women are more likely to become primary care physicians, pediatricians, internists, family practice physicians. OBGYNs are more women than men now. And then there are some fields that are still mostly men. So, for instance, anesthesiology is about 60% men. Emergency medicine is definitely more than half men. And then you get into the surgery field, and general surgery is definitely still more men than women. And then there are some subspecialties. Orthopedics, I'm not proud to say, is the worst. We have the lowest amount of women, the lowest percentage, but we've got some partners that are nearby. Interventional radiology, which are people that are the ones that when you have not you hopefully, but when someone has a heart attack and they have a clot in their heart, the interventional radiologists are the ones that kind of come in and save the day in the middle of the night and snake out these blood clots to save people's lives. Those people are very unlikely to be women. I think they're at 12%. Neurosurgeons are about 10%. But here's the kicker, urologists. So women would rather be urologists, which is doctors for penises. They would rather do that than be an orthopedic surgeon in today's day and age. And that's one of those statements that I'll make publicly that just opens people's eyes like, wow, what do we need to do to change this?
Well, it's
because
interesting.
half of our patients in orthopedics are women, and
Right.
half of urologist patients are not women.
So, is there anything that stands out to you that would be a deciding factor of why that's the case?
I think we all want to do something that we see somebody that looks like us and acts like us and have a role model, and we're not giving that well enough to young women. And I think that it's a cultural shift, that it really still feels like a boys' club in many ways. And if you
Orthopedics in general,
around,
or just surgery in general?
Orthopedics more than surgery, but even still in surgery, when you are such a minority in a room, it's interesting and different. Yeah, and that navigating that boys club, sometimes I feel like there was a brief stint where I was a manager of a boys lacrosse team in high school, and sometimes that's what I feel like when I walk into a room of orthopedics.
Well, and it's funny, I think that this is to your point, but it seems like, and this is just being stereotypical or sort of current society standings, but a lot of the positions you mentioned that are a little bit more female dominant, where there are more women in the field, at least from outsider with my very limited knowledge of medicine, seem to be more like caretaking positions, like where, more motherly, I guess, for lack of a better term.
Yeah.
And I wonder if that, to your point, is because sort of culturally we've set it up that way. And so to see people like you doing orthopedic work, if that, doesn't give women sort of, opens up the boundaries for other women so that they understand, oh, I could be an orthopedist too. It just hadn't occurred to me because I hadn't seen it done before.
That's absolutely right. And we have a really exciting moment happening in March, which is for the very first time, our Orthopedic Academy will have a woman president.
Oh.
And I am so excited to shout that from the rooftops. I am the chair of our communications cabinet for our American Orthopedic Association, and Christy Weber, who will be our first president, was actually also the first woman that I worked with way back when I was a resident in Houston. And it's going to be a huge moment for us to say, you know what, not only can a woman do this, a woman can be in charge of this.
Well, congratulations on that. Let's take a step back a little bit, go back to your residency. At the time that you were going through college and doing your residency, did you have kids at that time, or were you?
Yep.
Was that something that came on later?
So I had my first kid at the age of 35.
Okay.
And that was after. So when you go through orthopedics, I will tell you I became like my own person, my own working person, done with training at the age of 32. It's a very delayed gratification sort of a world.
Sure.
And then I had my first child at 35. When I was working at the University of Southern California, I worked with residents, and it was a wonderful program at that time because a lot of the women coming through as residents were having kids as residents, and I loved to see that and support that. And that's a thing now, and figuring out how we are going to support our women having kids, because those are the childbearing ages. When we're going through residency, most of us are in our late 20s to early 30s, which is when most of the population has kids.
Uh-huh.
And so when you put it off too long, your fertility goes down, the complications with it go up, and we know that that's an issue for women in orthopedics.
Well, that's why I asked, because like I mentioned earlier, my brother-in-law is going through his residency right now, and his schedule is so insane that I couldn't imagine having any kids involved. Luckily, in their situation, my sister's a stay-home mother and is able to take care of them. They have 3 kids, and it just seems like it would be such a stressful thing to be trying to go through school and do your residency and do everything that you need to do to get onto that next level. To even have a kid in the equation would almost be insanity. And being the mothering side of things would make it that much harder. So.
Yeah, and I think, we definitely, the women that I have seen do it, so I've seen a lot of married women do it. I've seen a couple of single moms do it. You need your people, you need your village. And I think you had mentioned early on asking about sort of the community of how the sort of stay-at-home moms interact with the working moms. For me, my stay-at-home mom crew has always been, I'm 12 years in, have been my people. My gosh, if my nanny has to call in sick or we fall down in some way, they scoop us up. And for whatever reason, they are telling their kids, hey, look at her, look at Jen. She's able to, go be a doctor during the day, and we're going to help her do that. And I don't know how I got that lucky in Los Angeles, but I am. So
in a crisis type situation, and the only reason I bring this up is last week my sister had kidney stones, and my brother-in-law is doing his residency, and she's got 3 kids, and they were able to kind of pass him off to the neighbors, and they watched him while she went into the hospital, and he literally was making his rounds, stopped for a second, came, checked on her, went, did his rounds, and once he was off, was able to come back. Are you able to call in sick as a surgeon, or how does that work?
That's a great question. I actually wrote a piece on this about 6 months ago, and it was published on Kevin MD, which is a nice conglomerate for bloggers who are physicians. And that's exactly what I wrote about, which is that so not only is there a stigma about calling in as a doctor for a family member. So let's say my husband needed me. There's a big stigma about that. There's even a stigma about me calling in sick for myself. So if I wake up and I barf, I got to tell you, there's a lot of times in my life where I actually came to work. And, that's bad. I shouldn't be exposing my patients to germs. I shouldn't be exposing my coworkers to all of that. And also, it's going to take me longer to get better, if I'm pushing through. So this stigma is really crazy. And there's a lot of practice settings in which there's just no relief. So let's say I am on call in an emergency room and there's nobody to call in. I'm going to be more likely to kind of gut through something like that. Whereas I'm very fortunate that in my current situation, if I were to have an emergency, I have a great group that can lean in and help me. And we've done it for one another frequently. But it's a matter of having a bit of redundancy in the system, which in healthcare today, there's not the dollars to do for a lot of people.
Yeah, no, that's really interesting. So to kind of go back a little half a step, I just wanted to ask, we had sort of touched on the idea of attrition and women not making it all the way through to become surgeons. So there were maybe some stumbling blocks along the way, but then we talked a little bit about pregnancy and starting a family and things like that. Is that, I know, like, for example, not to keep beating the drum on my wife and her career as a teacher, but I know there are many teachers that she's gone to school with who end up having a child and just not returning to work. Is that part of the attrition? I mean, because it must be a different experience for the women. The men can continue to go to work, without really any consequence because they have somebody there to watch their back. But for the women, whose body's just been through all that and everything else, like it seems like, it feels to me like the medical training would be like enough to say, no, I'm going back to work. But I wonder if that's maybe part of the attrition.
Yeah, that is one of the pieces, and it's interesting because there's this pay gap that's been identified between men and women in medicine, and one of the questions is it because women are more likely to work part-time, and yes, that sense of not coming back after having children, and there was a period of time about 10 years ago where there was sorry that ruined our sound for a moment. There was a period where there was a series of op-ed articles in the New York Times about women not returning to work or returning part-time after having children, and really a shaming kind of an opinion about that, stating that because when you go through residency, you're using federal dollars, you're using governmental dollars, and you're taking a spot. And so do you have some moral and ethical obligation to keep at it full force, regardless of what comes up in your life? And I think that's a very interesting argument. I think childbearing is part of it, but I also think it's our culture's inability to absorb sort of helping moms, young moms, through those years. And we have such a different approach to it than they do in Europe and most countries in the world, without having real ability to take maternity leave and much less access to daycares that are safe and good. So there's a lot of societal issues with that. And then there's also some stuff that's just not well understood. So you talk about attrition. So there's women dropping out of being doctors. But then there's also, once women are doctors, as women get promoted through being doctors, just like in any other field, the percentages of women drop off as you go through leadership positions or academic ranks.
Okay.
And it's not exactly well understood why that's happening. I think the first step is at least we're now understanding that that's happening, and people are writing about it and talking about it. And just by calling it out, I think we're going to move that needle a little bit.
Yeah, I suppose recognition is a big part of it. At least, understanding that there's something going on. So let's start to now drill down to the bottom of it. Better late than never,
Correct.
I suppose.
Correct.
So
Correct.
in your practice, I guess, do you work full time? And how do you manage, being mom and being everything else?
So I will say one name, and his name is Jay Blecker. That's my husband, and he works full time as well, but he is the one that shifts. So he owns his own business, and should a call come in, he's the one who shifts and gets to school and does what he needs to do. We have had a full-time nanny who is a saint and an angel for many, many years as well. My mother lives nearby. We don't call on her much, but she'll be there for me. And my sister lives nearby. But I will tell you that the biggest piece for me is having this partnership with my husband, of us understanding that although I'm the mom and he's the dad, we really share our parenting roles 50-50. And that was hard for us to get to, because societally, even in 2019, that's not very common. And there are some evolved couples that have gotten there, but it's a hard thing. And especially in Los Angeles and our kind of private school scene in Los Angeles, that's a pretty rare thing. We definitely surround ourselves with families that function like that, so that we feel like we're giving ourselves role models and co-role modeling for each other. But that I couldn't do it without that. I really don't think I could be working full time. And full time as a surgeon is not, an 8-hour day. It's typically a 10-hour day, and then some weekend call and overnight call. So there's some times in the middle of the night where somebody just physically has to be there. When you're a single mom and you're going through this, you actually have to have another body in the house to keep your kids safe if you get called in the middle of the night. And so the cost that you incur and all that is incredible.
Yeah, I can't imagine.
And that goes for single dads too.
Yeah. So do you mind me asking, does he work full time as well, or
Yes.
I'm sure that scheduling conflicts have to be a nightmare. Ryan's got a calendar set up with his wife to handle, sports games and all this other stuff, and I don't have any kids, so I don't have to deal with that right now. But on top of his day to day and everything, I could see that just being insanity.
Yeah, no, we're actually, it's funny just hearing your story, because we're not the medical version of that, but my wife and I run my own business as well. And so, when I need to take the time, my schedule is much more flexible than her school schedule. So I'm also the one that, goes and picks up the kid on short notice or whatever. So I can kind of relate to your husband in that sense.
And it's, there's also, I don't know how your school handles it, but our school, it took them a while to understand, wait, call dad first. Like they've got their algorithm. Like mom's number comes up first.
Yeah,
sure.
It's true. I don't know if that's, again, sort of a cultural predisposition or what it is, but yeah, my wife gets a call in class first every time. And it's usually to tell us, kid's tired, kid's doing whatever. But we have a 12-year-old and a 7-year-old. So we get more calls on the 7-year-old than the 12-year-old. But always goes to mom first. And then she's the one that calls me from the middle of her class while she's trying to give instruction. So, and that's what's even worse is she's in the school district. They know her as a school teacher, and they still call her in class. It doesn't make any sense.
Yes. I don't know what we're going to have to do in this world to make that.
Well, I think we're taking baby
change.
steps. So to that end, let's talk a little bit more about just, I mean, ultimately, and we're kind of have talked about this, but let's kind of take it maybe one step further. Like, obviously, the goal is to continue improving diversity and inclusivity in medicine globally, as well as in orthopedics specifically. What do you think can be done to help, not only get women into the field? It sounds like, much progress has been made in the education, so up to education, where we're about 50-50. But, from there, where people are falling off or going through, do you have any thoughts? I mean, you said, largely it's not been identified yet where people are falling off or for what reason. But I wonder if you had any thoughts personally about how we might go ahead and improve diversity and inclusivity in medicine.
Yeah, I think the role modeling of it. And so for every woman who does make it through, and especially makes it through to whatever leadership roles, has a true responsibility, and I'll kind of channel Sheryl Sandberg and her lean in for a moment. I think that the worst kind of crime that you can do or perform as a woman who's made it is to pull the ladder up after you. And so I think that that's a really important thing, us kind of leaning in and helping one another. I think that also just the resources and the culture of allowing people to prioritize their family, not just the women, but the men. And so if the men are enculturated like you in an evolved way to say, I'm also a parent and I'm also in charge of this. I think that that's really important. There's a lot of doctor-doctor couples who there's kind of two versions of them. Some of them are like the man's the surgeon and the woman's the pediatrician, and they still kind of have that hierarchy in their own family. But then there's the ones that are both surgeons or both pediatricians and really kind of equilibrate and role model that. I also think we have to start even before medical school, sort of in the pipeline work. In orthopedics, there are two phenomenal programs that reach out to young high school students and college students. There's a woman named Bonnie Simpson Mason who runs a program called Nth Dimension, and she specifically has her mission in life to recruit women and underrepresented minorities to orthopedics, and she is mentoring them and guiding them through this process to make them feel like they are not unicorns, and to really make them feel included. And the Perry Initiative is another one run by someone named Lisa Latanza, who's a hand surgeon in San Francisco, and she has created a nationwide program in which high school girls will spend a day with women, mostly women, some men, orthopedic surgeons, kind of simulating what we do in playing with power tools and putting fake bones together and learning how to sew pig's feet. And these are the kind of pipeline programs to say, envision yourself in this way at an early age. And so it starts early. And as far as, the nuances go, I think that there's some really low-hanging fruit that we're leaving out. For instance, really only in the last year or two have we understood at our national orthopedic meeting that we should have mother's rooms, which are rooms for women to pump if they need. Child care options. So at pediatricians meetings, and I'm kind of digging into what these options are in the different societies. When you sign up for a meeting, you check the box of I need child care, and it's offered at a discount or a rate or just, easily facilitated, whereas orthopedic meetings have never even thought of that because of the low numbers of women.
Well, you would think that a hospital would already have something like that in place for emergency basis for the actual patients coming in. How hard would it be to actually take on the kids of the doctors as well, or the staff that's there? It should be a turnkey solution, in my opinion.
I think that I wish it were. I used to, I work with Kaiser Permanente now. Before I did, about 8 years ago, I was at Children's Hospital Los Angeles, and there was a daycare not only adjacent to my hospital. At the time, it was 24/7. So there were a couple of times that my husband was traveling, and I would bring my little 2-year-old Lila, and she would, go to daycare at 2 a.m. while I fixed an elbow. That was incredible. And the fact that's a really unique situation that I think should be emulated, and I think is worth the dollars to emulate.
Well, just to have an on-site solution would be, 100% beneficial for you guys, just to know that there's an option there in case an emergency type situation comes up.
Well, and it's funny, like to Jennifer's point, I mean, it just hadn't even come up.
Yeah.
Like there weren't enough women in there complaining about the issue or recognizing the issue. And I also think you hit on something interesting, about, and this is one thing that it seems to be kind of missing in the all this Me Too stuff and everything else. And, maybe it's just me as a male talking, but it seems like it's not very inclusive of men who aren't the monsters or the perpetrators in the movement. And so to hear you say something about, that there's also should be concern or thought about how the fathers pay attention, manage their work and manage their children and manage their life, everything, I think is a really astute point. And I think it's ultimately where we're going to go, because I think, as we're trying to make things better for women and for more diverse people at this point, I mean, the hope is eventually you don't really even see the difference. I mean, of course, there's physical gender differences, but I mean, you'll just be Dr. Weiss. You won't be female Dr. Weiss. And so, and I think it'll be the same, at some point. Now, granted, we've got some evolution to get there, but I think, leaving men in the conversation instead of pushing them out of it, I think is a wise plan of attack. I mean, if for no other reason than, ultimately we need to all be on the same team.
I think so, and I have a huge interest in wellness and burnout prevention, and I think that if we're all going to take care of ourselves and take care of each other, we can't partition off the groups. We have to, there's a reason that the terms these days are diversity, equity, and inclusion, and that's, we're not asking for a special sort of package for some people. We're asking for everybody to be in it together. So I think you just said it so nicely.
Yeah, well, and I noticed, I guess maybe to that end, and maybe we'll hit this last topic before we get out of here. I noticed on your website you do some public speaking, and one of the topics that you speak of, and just maybe this is a branch off of the burnout tree, is a surgeon mom's guide to mindfulness and wellness. I wonder if you couldn't elaborate a little bit on, what you do in terms of, because I imagine in a high-stress career like orthopedic surgery, plus being mom and everything else, I think that, getting control of sort of your head and being able to be mindful of things is maybe something that gets lost on a lot of people because they're so caught up in the day-to-day or the moment-to-moment. And I wondered, since this is a topic that you've got some interest in, I wonder if you couldn't speak a little bit about, too, the role mindfulness and wellness play in not just your career, but maybe how other people could apply it in their life.
Absolutely. So I have a disclosure. My sister, Dr. Leah Weiss, she's a PhD. We call her the smart kind of doctor. And she put a little plug in for her book, which is called Hard at Work. And she is a mindfulness teacher, and she teaches at the Stanford School of Business. And so I have been definitely my sister and best friend has been teaching me for years and years. And when I became an intern and was branching through the beginning of residency, I was not a very kind person. I was sleep deprived. I was just a jerk. And I really had to be reined in. And exercise has always been something that's been in my life. Even when I was an intern, if I didn't sleep, I would prefer to do a half-hour run and not sleep than grab a half-hour nap. So I think that exercise, and now in 2019, there's so much data about how important exercise is, even in small chunks, to keep our not just our bodies healthy, but our minds healthy. For me, I have these chunks of ability to actually practice mindfulness. I practice yoga a couple of times a week, but that would never be enough because that's so separate and it's in a studio and it's quiet and it's blissful. But I have to capture these moments during the day. So for me as a surgeon, the first case of the day, I actually stand at a sink and wash my hands in a very methodical way. It's called a scrub. And when I'm doing that, everyone knows, do not talk to Jen. She's getting her mind in the right place. And I do my breathing and my mindfulness, and mindfulness is paying attention to where you are in the moment, and that's it. So you can do it while you're standing up and scrubbing if your mind can settle on that. And then I use it in my kind of day-to-day opportunities as well. So when I'm going to see patients, when I go back to clinic, every time I put my hand on the door to knock and go introduce myself, I close my eyes. In just 5 seconds, I take a breath. My friends walk by and laugh, like I can hear them giggling. Oh, Jen's doing that weird thing where she closes her eyes and takes the breath. But it's this gathering of like, okay, I'm going to walk into this room and I'm this person's doctor, and they may be scared, they may be mad, they may be, angry for waiting. There may be all of these things, and I'm going to kind of breathe and be present. And I think the other thing that we've talked about a lot amongst physicians and wellness, and I'm talking, by the way, because there's this canary in coal mine thing going on, which is the coal mine of healthcare can be very toxic. And I don't think that it's all on the doctors to figure out how to be well, but these are the tools that the canary can use to stay strong. And so for me, being grateful and just remembering that no matter how bad my day may seem, finding my little moments of gratitude. And people have been talking about that a bit maybe ad nauseum in the last couple of years, but I definitely find that those things. And I will say also, and I say this to my patients who are trying to lose weight, if I, as a full-time surgeon with 3 children, can find a way to work out 5 days a week, I think you can too. And I kind of call them to that.
Yeah. I actually, before our interview, I reached out to a friend who's kind of working her way into the medical field. Shout out, Emily. Asked her, what would you ask in this interview type situation? And she wanted to know about continuing education for someone in the surgical field and what has changed over the last 10 years that might have reduced on recovery time, newer trends that emerged in the last decade, more people seeming to require a specific surgery, maybe due to overall weight gain in Americans. That was her question. So any methods that may have changed or advances that have reduced in the recovery time?
Yeah, such a great question. So in orthopedics, when I was a resident many years ago, when we would replace somebody's joint, their hip or their knee, they were staying in the hospital for somewhere between 3 and 5 days and then going to a nursing home most of the time to help them recover the rest of the way. In today's day and age, in my organization, upwards of 25% of our patients are literally going home the same day after getting their joint replaced.
Wow.
Because of the way it's messaged, the expectations, the decrease in or the changes and enhancements in pain control. It's the technology of the way the joints are replaced. So that's a pretty phenomenal change.
Okay. So how much time do you have to spend on like a annual basis just staying up to date with the current changing technology? That's got to be incredible just by itself.
So I think one of the things that I learned very early on is that medical training is not about what you learn, it's how you learn and learning to learn. Because the way that I did an ACL reconstruction surgery when I came out of training is entirely different than what I do today. And so absolutely, I'm very involved in our national orthopedic societies and the continuing education there. And I think what's important about it, though, you can absolutely get that stuff done online. You can get all of your continuing medical education requirements done online and not have to go anywhere. But then you miss out on the relationships. And for me, I already told you I'm one of 6%. And so when I have the women in orthopedics, so if I go to a meeting and I get to be with those other women that are like me, that goes such a long way to my wellness and to my job satisfaction and to everything. So I love to go. I love to see the people giving the talks. I love to give the talks in person and see the people that I'm teaching. And so those things are old school but wonderful. But there's definitely webinars and online things and all sorts of options. And it depends on how you work and where you work. So for me, it is not hard for me to take. I get a week of paid time for education every year. And some places give you stipends to go get your education. For me, if I'm presenting something or giving a talk on something, I actually will, my organization will pay for me to go do that because they think that's important in giving back to the medical community. So everybody's got it a little bit different in terms of how they approach that. But it is an absolute, you can't go to medical school, do residency, and then think you're done. It is every single week and month understanding what's new out there and how to make sure that every one of your patients gets the latest and greatest.
Cool. Well, thanks for that. So just to sort of put a bow on this thing, Jennifer, where can people find out more about you, what you do, maybe follow in your footsteps?
I would love to help anybody who's interested in being anything like me. God help you. But I am at my website is jenniferweissmd.com. On Twitter and Instagram, I am my mom the surgeon. And I get messages almost daily from people asking for bits of advice or just little tips and tricks. And I'm always happy. I'm good about returning those on social media. And you can leave comments on my website, by my blog, and I'm happy to reach out and give you whatever pearls I may or may not have.
Cool. Yeah, no, the only real complaint I have is on your blog, I see you wearing an LA Galaxy jacket. And, I mean, I get it. You're in LA. I understand. But, I don't feel good with you rocking LA Galaxy.
I used to get to take care of them. They're amazing. Oh, I'm so sorry. That was offensive.
Yeah, of course. We have Real Salt Lake here in town, and those two are oil and water. So it's kind of fun. So anyway, cool. Well, thanks so much, Jennifer, for your time. I apologize for the technical difficulties getting you on air, but
no worries.
I'm glad we were able to work it all out. Any parting shots, anything before we get out of here?
No, you guys are a pleasure and very evolved humans. I appreciate talking to you.
Well, we do our level best. I don't know if my wife would always vouch for it, but I'll take it. If that's the impression I left you with, that's a winner. So cool. All right. Well, thanks so much. And thanks, everybody, for tuning in. We'll see you next week. Mike, anything else?
No, I was just going to say thanks for making the time for us. I know you're really busy.
All right. Cool.
You guys take care.
Yep. You do the same. Thanks so much.
Bye.
Bye-bye.